Everyone, welcome. Thank you so much for joining us again today. My name is Marcia Titus Prescott. I'm a registered nurse at the Institute for Community Living and part of ICL's Integrated Health Team. Today you are going to hear from us in reference to quite a few of, well, actually 4 webinars that we have been doing. This is the second, which is going to discuss our Collaboration for Health, in which we feature disease management for individuals and families. For those of you who joined us before, we had a webinar on behavioral health medical homes, in which we discussed our approach to integrated health, mental health, and substance abuse in our programs here at ICL, both outpatient clinics and our residential programs. Our follow-up webinars will be discussion on support tools, optimizing health records for integrated care, and our final webinar will be on culture, spirituality, and community factors, and reaching out to address health disparities in our community. Today's webinar, we will be defining the role of self-management in a person-centered integrated health, in which consumers take responsibility for their health. We will be featuring the key features of motivational interviewing, which is used across all our ICL programs. All our staff are trained in motivational interviewing, so the language across the board is the same. We're also going to be featuring our tools, which will give you an idea of selecting and creating your tools to foster collaborated health goal setting and achievement. Institute for Community Living, we are a non-for-profit agency that has over 100 programs, and we service over 10,000 consumers. Our consumers are consumers who are self-managing mental illness, but we also have a population that we service, individuals with delayed developmental disabilities. The majority of our programs are in Brooklyn, New York. We have housing, case management, we have 3 ACT teams, a PROS program, mental health clinics, and shelters, and we also have a health home. ICL also founded Healthcare Choices, which is our FQHC, and this provides services for many of our programs, especially our residential programs. In housing and case management, 70% of our consumers are self-managing schizophrenia or schizoaffective disease. Primarily, our workforce consists of paraprofessionals, and nursing is very limited in our programs. As you know, we do have a crisis. The crisis is that people with serious mental illness are dying an average of 25 years earlier than those in the general population. 60% of the mortality is due to treatable and preventable medical conditions, heart disease, strokes, diabetes, to name a few. Our rough estimates suggest that 40,000 of the people with serious mental illness die prematurely each year. And here at ICL, we have lost some of our consumers over the years to these preventable and treatable medical conditions. The chronic conditions, 70% of people with serious mental illness have 1 chronic condition. 45% have 2, and 30% have 3. Substance use is additional risk that people with serious mental illness face. People with serious mental illness are more than twice as likely to have diabetes. And we do have this information with the consumers that we work with at ICL. People with diabetes are twice as much likely to have depression, which complicates a diabetes management. Why are people with mental illness at greater risk? Symptoms of mental illness, such as poor motivation, lack of decision-making, low energy, lead to reduced physical activity. Reduced physical activity also causes obesity, which puts our consumers at risk for developing some of these comorbid conditions. Changes in appetite, whether it be secondary to their symptoms, medication side effects, or even income, because a lot of our consumers are living on fixed budgets. They come from low-income neighborhoods. The diet that we are asking our consumers to live a healthy diet, but many times they can't afford a healthy diet. The areas that they live in, they don't get the best foods. The quality of foods are not of the best. Antipsychotic and other medications do increase the risk of high dyslipidemia, diabetes, and stroke. Substance abuse, as we all know, increases symptoms, worsening self-care, and has direct health effects in terms of our consumers self-managing their conditions, whether it be mental health or physical health. People with mental health illness rarely receive needed healthcare interventions. And here at ICL, we see the importance of integrated health. It's all about integration. It's all about collaboration. Why do people with mental illness have difficulty accessing care? The behavioral health force receives minimal training on physical health illnesses. Here at ICL, we have been addressing this through our integrated health program. Physical health problems are often misidentified as mental health symptoms of intoxication. In the past, as one of our ICL's triage nurses, I would have received a call that would say, Mr. H is presenting with slurred speech. He seems confused. His gait is unsteady. We think he needs to be hospitalized because he's probably going to be decompensating. Now the calls that I get is Mr. H, who's self-managing diabetes, has a blood sugar reading over 400, and his blood pressure is out of the recommended range by his PCP. So I think I need your assistance because he's now presenting with some confusion, unsteady gait, and I'm not quite sure what it is, but I need to share this information with you. Discrimination based upon mental illness, addiction, race, and socioeconomic factors is another reason why people with mental illness have difficulty accessing care. As we know, the healthcare system is fragmented. We struggle without mental illness to try and maneuver within the healthcare system. Just imagine what it's like for our consumers who are self-managing their mental illness as well as their physical illness in this fragmented system. Financing and regulatory issues also present as a difficulty. A lot of times there are billing issues, there are issues surrounding their insurance. Some places do not accept their insurance, but these are the things that ICL that we are aware of and are working with. Person-centered approach, this is the approach we use here at ICL. The person at the center of all this work is the consumer who directs the care. The hub of this treatment, of the person-centered care, is the therapist or the psychiatrist who works with consumers to develop a healthcare team. The healthcare team would involve the nurse care manager and all the other providers who would be working with this consumer to take care of their health and help self-manage many of their medical conditions. Nursing support management. Here at ICL, we have developed several tools which help us in terms of working with our consumers to identify the risk, and also in terms of identifying concerns that they may have around their medical conditions. We have risk assessment tools which are used at intake. These tools are reviewed by our nurse care manager, who uses this particular tool to determine the level of risk. With the level of risk, like a high-risk consumer would be someone who has unstable medical condition, someone who is not adhering to treatment, and someone who may need a higher level of care. Higher level of care could mean from home care services, visiting nurse services, or just some extra support in the home. We hold monthly multidisciplinary review teams at all our programs where we discuss our high-risk consumer. Nursing support training of behavioral health workers is also important to us, and this training happens at all levels of our programs, from our clinical staff to our supportive staff in our residential programs. Self-management. Basically, self-management is working with the consumer to really manage their health, us providing wellness, ongoing wellness education to our consumer and staff. Motivational interviewing is used across the board to support the changes made as our consumers work to self-managing their health. As we move along in the webinar, you would actually hear much more about motivational interviewing and the action steps that are used to assist consumers in better managing their health. We also have tools that facilitate conversations around health. If there are any tools that we've discussed in this webinar you may be interested in, you can contact us. The contact information will be provided at the end of the webinar. The responsibility lies with the person, and as clinicians, as supportive staff, our role is to help the consumer self-manage their medical conditions and their overall health. So it's really meeting the consumer where they're at and using motivational interviewing assist us with this as we use these techniques to engage our consumers.
Hi, I'm Rose Sultana-Cordero. I'm the clinical coordinator on the integrated health team. And our next section is going to focus on motivational interviewing, the techniques and the skills involved. But before we start, we have a poll question that we would like the audience to participate in. The question is, motivational interviewing is a part of our agency's culture and treatment of clients. Yes, no, or we are starting to implement MI. And I'll give everyone a few minutes to respond. Okay, waiting still for the responses to come in. Okay, it says the poll has ended.
Oh, there we go.
Great. So it sounds like a good chunk of people in the audience are familiar with motivational interviewing. A few, 4%, answered no, and we have about 14% that are starting to use MI, which is great. Fantastic. The next couple of slides are going to be a very, very fast overview of motivational interviewing, where it came from, the skills and techniques involved. So this presentation really doesn't do justice to it. If there's anyone in the audience that wants more information on motivational interviewing, please contact us, because if you could participate in a training, and some trainings can go for a day, can go for a week, that really give you a good feel of motivational interviewing, because it is a mindset. Okay, very briefly, motivational interviewing came out of the substance abuse field, and it was research that was done in trying to understand what motivates people to change and what helps them to identify areas that they want to change in and try to maintain that change. although the roots are in substance abuse, it's starting to branch out into areas of wellness, and you will notice articles in nursing journals, psychology journals, wellness, medical journals that are looking more closely at motivational interviewing and trying to use that skill in helping people to identify wellness goals in maintaining and self-managing health. On the screen in front of you, that's just the tip of the iceberg of studies that are out there that show motivational interviewing being used in areas of weight loss, maintaining A1C level for type 2 diabetes, for well-being and quality of life. These are just a few of the many wellness areas that motivational interviewing is starting to appear. Okay, very briefly, motivational interviewing and stages of change are two of the foundational pieces of a lot of the work that we're going to be talking about in this webinar. Stages of change look at the different levels that people go through when they try to identify areas or behaviors that they want to change. Pre-contemplation stage, and I'm sure many people out there are working with clients that are in this stage where they feel everything's fine, nothing needs to change, nothing needs to be altered. Going to contemplation, where people are ambivalent, wondering if they can make a change, how to make that change, to the area of preparation, where they identify a goal and are seeking help in making action steps towards that goal. The actual action, where they're working on the steps towards their goals, and then the actual maintenance. Recurrence is for that area where people have slipped back. I don't know if there's anyone out there who has ever tried to maintain a diet, but you always have those 1 or 2 slips or days when you kind of go off your diet and need to go back on. So recurrence, that stage tries to incorporate that experience where people may have been maintaining behavior towards a change and then have a day or a time when they slip up. Again, this is just a very brief overview of some of the interviewing skills that are involved in motivational interviewing. It follows the abbreviation for FRAMES, so that gives you some abbreviations to remember these by. Very quickly, feedback that you receive from consumers around their health behaviors. Responsibility always lies with the consumer. They're the ones at the end of the day that are going to decide whether they're going to stay on that diet, take their medication, or follow up with their PCP. Advice about making healthy choices or alternatives to health behaviors, that's given in a very non-judgmental manner. Menu of options, what may work for one consumer may not be appealing to another. If you're trying to engage someone in physical activity, maybe walking around the block is just where that person's at, but that might not be where someone else is at, and they may want something more challenging or more interesting to focus on for physical activity. Empathetic counseling, using a tone of warmth and respect. And the bottom, but not at all least important, is self-efficacy. There's a great deal of empowerment in helping a client identify a goal, watching them go through the action steps to achieve it, and maintaining it. And that's a very important piece to this whole project. These are some key MI techniques. Again, if you are interested in training around any of these, because it is a mindset, and sometimes when you get into a power struggle with a client over health behaviors, it's sometimes hard to remember that you want to roll with resistance and develop discrepancies. So being in training can sometimes help get into that mindset. But these are some of the key techniques where you help a consumer develop discrepancies. So if someone wants to maintain or self-manage their diabetes through diet, and you see them frequently eating foods that are not going to help them manage their diabetes, to, in a respectful and non-judgmental way, draw out these discrepancies so that you can have a conversation. And rolling with resistance, again, at the end of the day, it is the client that's going to decide what behavioral changes they're going to make And rolling with resistance is a big part of keeping communication open so that you can continue engagement. So MI on paper, what does that look like? We have created several workbooks, which we're going to talk a little bit more in detail later on in the webinar, that are really based on motivational interviewing, the techniques, the skills, the engagement. And it's a psychoeducational technique that's built into the workbooks that helps clients identify where they're at as far as changing a behavior and identifying that behavior and what steps they feel they can make towards achieving that goal. The materials that we have created are on a 5th grade reading level or lower. The same workbook that a consumer uses is the same workbook that a staff person would use, so that both people are using the same material. It's written in a very easy, it's very pleasing to look at, very visual, and the language that's used is very general, and you don't have to be a medical professional to understand it or share it with a consumer. Materials can be used both in group or individual work, and it's a great facilitation tool for family work either in the office or at home. This is a summary of some of the areas covered in our Healthy Living Workbook. They are general areas that everyone should be focused on if they're trying to self-manage their overall health. They run the gamut of taking care of your mental health to eating healthy foods, being physically active, taking medication, quitting smoking. And within each of these chapters is a component that allows the consumer to identify their stage of change and what steps, if any, they would like to take towards a wellness goal. The diabetes module, we also have a diabetes self-management workbook that, again, is based on motivational interviewing and techniques. It has a general chapter that's on the ABCDEF of diabetes, the general important screenings that people should be aware of if they're diagnosed with type 2 diabetes, creating a sick day plan, checking blood glucose. We also have modules on COPD and hepatitis C that follow the same format and have a motivational interviewing foundation. So the diabetes workbook focuses on the 6 essential screenings that you should be on top of, aware of, if you're diagnosed with type 2 diabetes. We use the ABCDEF, again, as kind of a tool for people to remember, A being for the A1C level, B for blood pressure, cholesterol, kidneys, we kind of cheated a little bit on that one, eyes, and then feet exams. And this is an easy tool that we have found with consumers that helps them to stay on track and to remember the screenings that they need. We also have a Healthy Living Workbook for children. It is divided into 3 areas, minding your feelings or helping them to identify feelings, being physically active, and also choosing healthy foods. In the spirit of motivational interviewing, we try to provide tools and techniques for staff to engage consumers on identifying these goals. And everyone has goals. Everyone has something that they want to work for and want to achieve. You may have consumers that have type 2 diabetes, and maybe having more fruits and vegetables is not on the top of their list, but I'm sure being more independent in the community and getting housing is. So sometimes it's helping them to identify those goals and looking at the steps that might help them achieve those goals, and wellness being one of them, being stable in the community and taking care of their health, and trying to think about what they would need to achieve these goals, what it would mean to them, what they would gain, and what they would lose. And at the end of each chapter, we have this Are You Ready scale. And again, this helps the consumer and also staff to get an idea of where this person is at as far as stages of change. Because if they don't want to change anything, if they feel everything is fine the way it is, that's good information. Then you know that in this area, this client is not ready to change, and there may be another wellness area where they are more open to change or looking at behavior. Action steps, we try to break it down as simple as possible so that there are many achievable steps. These steps are identified by the client, and they can be as simple as, in the area of physical activity, walking around the block once a week. They're developed and reviewed by the consumer, and again, a staff is there to facilitate and to guide them in trying to find the goal that is best suited for them. The action step plan review pages are at the end of each of the chapters. The action step planning is very concrete. It goes through the who, what, when, where, how, and why of doing the action step. Who will help me? When will you take the first action step? Where will you do this? So that it's not only very concrete, but if a person has difficulty or there's a challenge in achieving the action step, you can go back and review where that challenge is so that some troubleshooting can be done. And once the goal is achieved, it should be celebrated. Even if it is something as simple as drinking water once a week on a Wednesday after group, because any achievement, any completion of a goal is a step towards achieving the higher goal. And again, if someone has difficulty achieving the goal that they have identified, it's an opportunity to review. Well, maybe that wasn't the action step or the goal that you're ready to work on at this point. And it's an opportunity to problem solve and maybe identify another goal with action steps and work towards achieving that step.
Hi, I'm Jeannie C. I'm the Associate Chief Medical Officer at ICL, and thank you to Marcia and Rose for taking us through how we as a behavioral health and now multidisciplinary integrated healthcare team can use motivational interviewing and use psychoeducation to empower our clients, both adults and children, to take better care of their health. The workbooks that Rose has just spoken about are part of our self-management toolkits. You can see in this photo what our Healthy Living and Diabetes workbooks look like, and when we print out the chapter booklets, what those look like as well. So I'm going to talk to you a little bit, just going to introduce you to the full toolkit, which includes the workbooks and some mini cards, a quick guide that supports the behavioral health workers in providing trainings to our consumers on these materials, and as well letters to PCPs and psychiatrists that let them know that consumers are working on this material. And at ICL, what we've done is put all of these materials on our intranet so that anyone at any computer in the agency can click on a little doctor's bag called Clinician's Toolkit and go in and get these materials out. This is just to show you what our Healthy Living mini card looks like. It allows you to record the 5 primary care screenings that we determined from the evidence were the most important for consumers to know about and record and ask their doctors about. And this is just an example of the clinical pathway that we provide to our behavioral health workers. Here, I know it's very tiny and we're not going to go through it. We are actually going to discuss this in more detail in our next webinar on decision support tools, of which this is one. So please join us for that if you'd like to learn more about this. But this helps clinicians to know step by step from diagnosis right through to outcome measurement, what kinds of evidence-based practices do we expect that they will implement in their work with consumers. This also we will discuss more next week, but this is an example of the back of the front of the quick guide for the clinicians was that clinical pathway. The back is this physical health goal planner, which dovetails with our EMR and the treatment and service planning modules that are there, where we really try to direct our therapists and clinicians to select health goals, help consumers select health goals that are consistent with what is taught in the Healthy Living workbooks and materials, so that if someone's learning about, let's say, hepatitis C, it gives them some suggestions of narratives that they can write for a goal that in our EMR, it says learn, practice, disease, self-management. But, you know, if someone has hepatitis C, you can identify 2 ways to prevent transmission as a treatment goal in the next period. I wanted just to poll people, too, and see, are people including physical health goals in their treatment and service plans across the agency? So the responses we're providing are routinely, occasionally, or never, and give people a little bit of time to click on their answer. I think, you know, in the past, there's been this has been a big shift, I think, for our field, where before we thought that we were not allowed to include physical health goals in a behavioral health treatment plan or service plan. And now we're learning that, you know, not only are there ways to do that, but this is something that's really necessary to provide whole health care to our consumers. And we're waiting for the answers now. Looks like it takes a minute to upload. All right, so about 29% of our group says occasionally we include physical health goals. About 19% say routinely, which is great, and 6% say never. And if you'd like to, if you're a never participant, you know, and would like to help us understand, you know, what, feel free to type that into the chat box. But thank you, everyone, for answering that poll. And I'm glad that across, you know, the CTAC universe, people are including more and more physical health goals into treatment plans, which is something that we've been working on too. You know, one way because I think for us, buy-in from the clinicians has been really important. And one way that we've tried to, you know, communicate this information to therapists and clinicians about their role in managing physical health is that physical health and behavioral health are intimately connected. You can't really separate them out. And this is one example, even for children, and both children and adults have asthma, but this is something we try to teach to children and families, their parents as well, so that we can get more long-term you know, outcomes and buy-in as well. Anxiety triggers asthma. Asthma medication can cause anxiety. Asthma attacks and panic attacks often look the same, but both send you to the ER sometimes. So all of those things, you know, are hard to tease apart. And yet, what we can do as behavioral health workers is teach coping skills that include relaxation techniques or stress reduction. And that can actually treat asthma. And so that, you know, for behavioral health workers to know that can, I think, really encourage them to introduce asthma care into their treatment and service plans. And then, of course, you know, if you use inhaled drugs, that's going to worsen your asthma. And so that's maybe another way in which smoking cessation can be incorporated into the treatment plan. And likewise, you know, when we provide nursing support and training to our behavioral health workers, you know, topics like Hep C become really important, because when you have a client who has Hep C and they're going to think about trying the interferon treatment, for instance, that can cause a significant amount of depression and fatigue, sometimes suicidal thinking. And so, you know, medications like this that are very much, you know, physical health medications can still greatly influence your work as a behavioral health worker. And so learning about the specifics of Hep C and how you prevent transmission, how alcohol use may be implicated in your long-term recovery. These things, I think, are very important for behavioral health workers to know, and to also find ins with clients into managing both their substance use, their mental health, and their physical health at the same time. So I'm going to present to you a little bit of our, you know, about our outcomes from our pilots of these materials. From January 2009 to present, we've been piloting healthy living across ICL at 49 different programs that span not only clinics, but housing, case management, and day treatment programs. Or sorry, that should read pros now. We've done this work with support from a number of foundations. And we've had about 1,400 individuals participate, trained a lot of staff, distributed a lot of workbooks, and had people also participate in cooking and physical activity programs. In the first 6 months of our implementation, we found a significant decrease in number of cigarettes smoked, and so that was really encouraging. I think it stayed stable after that, and we have been working with NYU to process our data further using different statistical models to try to understand the process of change over time as well. So, stay tuned for that. We have found consistently, though, for individual, for groups of cohorts of consumers, I should say, increases in routine primary care visits after people have begun using these materials. Likewise, we implemented a diabetes comorbidity initiative across New York City in 54 programs in 19 agencies, and trained about 324 staff in this, and had data collection for a number of consumers. And the most exciting data for us was that, Rose has spoken with you about the Diabetes ABCDEF, which are the 6 diabetes quality improvement interventions that we ask consumers to self-manage. And at the beginning of the implementation, at baseline, we had about 19% of people that could report all 6 test dates. And that's not easy for any person with diabetes to get all 6 things, which include, an eye exam done. But after 6 months, it went up to 35%, and that was statistically significant. So we hope that, that implementation of these materials for people with diabetes, for instance, continues to support them in achieving health goals such as this. When the work gets hard, we remind ourselves of the success stories that people have had, and recently we had actually a consumer write a poem about one of our programs, which really was quite encouraging to us. But Ms. B was one of our diabetes participants, and she had lost 32 pounds and dropped her A1C level from 12, which is astronomical, to 7, which is much healthier with her participation in diabetes. And she, one of the things that encourages us most, is her story that she had this infection in her foot, and she didn't know it was an infection. She knew there was something on her foot. But before, she didn't know that she needed to get it checked out. She could walk around with it and that it would heal by itself. But in that group on taking care of her feet and taking care of your feet, she learned that, this could be a problem. So she went directly to the foot doctor. They caught it just in time and were able to heal the infection because of the information from the workbook, and that made us feel pretty good. So, we presented you sort of our model and our materials, and what we're hoping is that folks will participate with us in a learning collaborative around behavioral health medical homes, how to create an integrated team, as well as, how to implement if you are interested in these tools, these kinds of tools in your program as well. And please do contact us. Rose Sultana-Cordero, who you just heard from, her email is rsultana-cordero@iclinc.net. I put the her address in the chat box, so please contact us if you're interested. But what we want you to take home from today is that person-centered integrated care begins and ends with self-management. The most important thing here is that the consumer is engaged and empowered to take care of their own health. Motivational interviewing we have found tremendously helpful and invested a lot in training in this because it helps people progress through the stages of change, which are, if anyone's ever made change, this is not easy. And so having this kind of expertise, supports our clinicians in helping people with that. and that workbooks, other disease management tools, there are a lot of ways in which we can promote whole recovery for the people served. And, we want to emphasize, too, that this begins from the children, working with children and their parents, and then right through the lifespan, because we see the whole lifespan in our clinics is really important. I want to thank all of these people, and especially Kara and Evelyn for coordinating this webinar. And then I just want to leave some time for questions and encourage you again to join us for our upcoming webinars.
Hi, everyone. Thank you so much, Jeannie. I just want to make sure I'm on mute.
We can hear you.
You can hear me. Good. Sorry, because sometimes I'm on double mute. Thank you so much. This was really a wonderful presentation, and we really appreciate hearing from you and your experience, as well as Rosemarie and Marcia. It was a wonderful presentation. We do have several minutes left for questions. So if anyone out in the audience has questions for Jeannie, Marcia, or Rosemarie, please chat them in the chat box, and they will be happy to answer your questions. And again, they gave you their contact information, but I want to remind you that all these slides and these recordings will be on our website at www.ctacny.com. So if you have any questions right now, please chat them in the chat box, and I'm sure somebody would be happy to answer them. No questions? It doesn't look like we have any questions, Jeannie or Rosemarie or Marcia.
If we were clear as much.
Do you have any last thoughts or comments that you'd like to share with the audience? Oh, sorry, here is one. Is there a cost to the workbook tools? From Carrie.
I think, actually we haven't determined that yet. We have to, get the printing cost. But what we'd really like to do is set up a learning community. We have grant funding from the New York State Health Foundation to set up a learning community to disseminate our behavioral health medical homes model. So we'd like to, use that forum to share these materials with CTAC members, but I don't think that we can print the workbooks, for instance, as part of the grant funding. And so, we'll have to work out what that's going to cost.
Okay. Okay, so we're going to work on that, Carrie. We'll get back to you about that.
And
any other questions? Well, I think it's really important work that you guys are doing at ICL, and I'm glad that you're able to share it with others throughout New York State. Do you have any last thoughts or comments for the audience today?
I think just in terms of, this work is challenging, and what we've found is just having different materials readily available, whether they were from us or from New York City DOH materials. They have been really helpful in getting buy-in, making the work easier for clinicians to incorporate into their practice. And so just encouraging people to think of it that way.
And I think from me, the nursing point of view, I just feel that it's so important for collaboration, because we could do all this good work in-house, and if we don't have the support and collaborate with other providers within the community, a lot of times, things just, kind to fall through the cracks, especially in terms of specialist services, because in-house we can't provide all the services. We have to depend on other providers within the community. So it's talking to them about what we're doing, and also encouraging our consumers to advocate for themselves, but also advocating on their behalf.
Great. Thank you, Marcia. I completely agree with you. I think collaboration is really important when it comes to the quality of care for people. Rosemarie, did you have any last thoughts?
Just that I hope people will contact us about the motivational interviewing, because again, that was a very brief, encapsulated presentation, and there's a lot more to it than the few slides that we presented. And if anyone has any questions, be more than happy to answer their questions, if not now, through the contact information that was provided.
And we hope people will. Okay.
Go ahead. Sorry.
Oh, sorry. We hope people will join us for the next webinar, which does talk about tools that can help clinicians to make important decisions about at different junctures of care, and how to improve electronic health records or paper health records, because that's when we started this work, was when we had a paper health record, to provide integrated care. And then the last one is an exciting, we have experts on cultural humility, spirituality, and community contextual factors coming together to provide a talk on how to address health disparities in our communities, and so I hope that you guys will join us for those as well.
Thanks, Jeannie. I hope so too. We did have one question though that came up. Someone named Kirsten is wondering about if the workbooks are available to CTAC members, which we're working on figuring that out, but more importantly, she did a search for the prompt cards that she thinks would be really useful, and she couldn't find them. So any direction that you could offer would be appreciated, she said. So Kirsten, perhaps the best thing is to reach out to Jeannie and the team, and they can further answer your question. So if you can, Jeannie, could you pass me the ball and we could go through the rest of the slides and the contact information?
Oh, right. I can go back to the contact. Yeah, I'm not sure how to pass you the ball, so this might be easier.
Oh, I got it. I got it, actually.
Oh, you got it. Okay.
So this is the contact information, especially for Kirsten. You can email rsultana-cordero@iclinc.net, and I'm sure they'll be happy to answer your questions. So these are some references from today, which may be really helpful for some of you. And just wanted to go over our upcoming events really quickly. Next week, the next 2 weeks, we have other webinars from our ICL team, which are a follow-up to these 2 weeks. I think they'll be really helpful for everyone. And then what's not mentioned on here is we're going to have a webinar on November 8th. It's a Friday, and we're going to have Dr. Aruna Jha return on suicide prevention. So hopefully you can all join us then. It doesn't look like there are any more questions, so I think this concludes our webinar today. And we'd like to say goodbye to all of you. Jeannie and Marcia and Rosemarie, thanks so much again. And I'll let you just say goodbye to everyone.
Right. Thank you, everyone, for participating. We know that your lunch hour is precious, and we appreciate it. And thank you, Kara and Evelyn, for setting this up for us.
Thank you. We'll see you next week. Have a great day, everyone. Bye-bye.
Thank you.